I think there will be vaccine that initially be available sometime between November and December, but very limited supply and will have to be prioritized. If you're asking me when is it going to be generally available to the American public so we can begin to take advantage of vaccine to get back to our regular life, I think we're probably looking at late second quarter, third quarter, 2021.
That's a year from now. And that was the CDC director, Robert Redfield, testifying this morning to a Senate hearing on the coronavirus response, proposing a timeline about widely available vaccine distribution that is very, very different from the politicized, much shorter timetable we've heard recently from Donald Trump. It comes one day after Trump raised questions about the need for a vaccine. Here was his shift in messaging last night during the ABC News town hall.
It's probably going to go away now a lot faster because of the vaccine. It would go away without the vaccine, George, but it's going to go away a lot faster with it.
It would go away without the vaccine?
Sure, over a period of time. Sure, with time it goes
and many
away.
deaths.
And you'll develop herd, like a herd mentality. It's going to be herd developed.
Herd immunity, we assume, is what he meant, but herd mentality is worth discussion. We'll get to that. It's the process of eliminating the virus's ability to spread by infecting an incredibly high percentage of our population and likely putting the most vulnerable Americans in a very dangerous, life-threatening position. Yesterday, more than 1,000 Americans died from the coronavirus as the United States inches closer to the tragic milestone of a death toll of 200,000 of our fellow citizens since the pandemic began. Joining our conversation, global health policy expert and MSNBC medical contributor, Dr. Vin Gupta is with us. Also joining us, senior advisor to the Biden campaign and former White House Ebola response coordinator, Ron Klain. Now, Dr. Gupta, I think herd mentality is something that's happening, but we'll save that for a different conversation. Tell me what herd immunity looks like, if that's what slipped out from Donald Trump's lips last night.
Sure, Nicole, and it's good to see you and good to be here with Ron. The concept of herd immunity is this notion that enough people have developed either natural immunity to the virus because they've been infected and now have their own body's defenses at work, or they've received a vaccine. And we think if that number is about 60% of the population in the United States having one or the other, a vaccine or natural immunity, even though we don't really know what that means right now, how long that will last, that the virus will stop transmitting itself. I'll tell you what that means in the short term. That means people will die. Those who are vulnerable, as you mentioned, those who are 65 and older with pre-existing conditions. We put a bunch of people at risk who do not need to be at risk by even talking about this, in really casual terms, the way the president does. He doesn't take this seriously, and it confuses people. People are confused by these terms, but it certainly would mean that people would die. Some forecasts suggest 400,000 just by December 1.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.